When was the last time you looked someone in the eyes and wondered whether hidden damage was silently stealing your own vision?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're uncovering how diabetes injures your retina long before any blur, floater, or streak warns you something is wrong.
I'm Alara Sky. Diabetes-related vision loss now strikes nearly 1 in 3 adults over 40 who live with elevated blood sugar, yet most discover it only after irreversible harm. Let's break down why those fragile eye vessels fail and the concrete steps you can take to protect what you see every day.
Every minute your retina turns light into electrical signals, but high glucose quietly weakens the capillaries that feed this tissue. As walls thin, blood and plasma seep where they don't belong. Your eye tries to compensate by growing new vessels, yet those replacements are abnormal, brittle, and prone to rupture.
Left unchecked, those ruptures bleed into the gel that fills your eye, casting shadows that look like drifting cobwebs. Scar tissue forms, tugs on the retina, and can tear it away from the back of your eye. A detached retina is an emergency that often ends with permanent blindness if treatment comes too late.
You won't feel pain while this unfolds, and early vision changes appear and vanish, tempting you to dismiss them. That is why scheduling a comprehensive dilated eye exam every year, whether you have diabetes, prediabetes, or gestational diabetes, is your first and most reliable safeguard.
Blood sugar is not the only number threatening your eyes. Uncontrolled blood pressure tightens vessels, cholesterol thickens them, and smoking starves them of oxygen. Together, these factors magnify retinal damage faster than glucose alone. Tracking each metric and acting on unfavorable trends keeps the disease from accelerating.
Certain groups face even greater odds. Adults over 65, African Americans, Hispanics, American Indians, Alaska Natives, Pacific Islanders, and women who enter pregnancy with diabetes. If you belong to any of these categories, consistent monitoring becomes non-negotiable because progression can surge during hormonal or circulatory shifts.
Conventional medicine often waits for advanced disease before stepping in with injected drugs, lasers, or surgery. Those tools work, but prevention is simpler, safer, and far less expensive. The root strategy is restoring metabolic balance so vessels stay resilient instead of brittle.
That restoration begins inside your mitochondria, the tiny engines in every cell that convert nutrients into energy. When they falter, glucose piles up in the blood, setting the stage for retinal breakdown. Vegetable oils loaded with linoleic acid are chief offenders because they clog mitochondrial membranes and stall energy production.
Replace canola, soybean, corn, sunflower, and similar oils with tallow, ghee, grass-fed butter, or coconut oil. Keep daily linoleic acid under 5 grams, and ideally below 2. Cooking at home with whole ingredients is the quickest route to hitting that target and jump-starting mitochondrial recovery.
Fuel those recovering engines with carbohydrates your body actually handles well. Ripe fruit and plain white rice digest cleanly and supply glucose without excessive digestive stress. As tolerance improves, add well-cooked root vegetables. Wait on legumes or intact whole grains until your gut shows no signs of bloating, gas, or irregularity.
If your gut is inflamed, fiber can backfire. It ferments, feeds harmful microbes, and triggers endotoxin release that further worsens insulin resistance. Stick to low-fiber, easily digested carbs until symptoms settle, then reintroduce fiber gradually as tolerance permits.
Chemical stress matters too. Plastics leach xenoestrogens, and wireless devices bathe tissues in electromagnetic fields, both of which sap mitochondrial output. Store food in glass or stainless steel, skip plastic drinkware, and keep phones away from your body while sleeping to lighten that daily toxin load.
Next, quantify where you stand. A single fasting blood draw for the HOMAIR test calculates how well your insulin keeps glucose in range. Multiply fasting glucose, milligrams per deciliter, by fasting insulin, micro international units per milliliter, and divide by 405. Scores below 1.0 signal healthy sensitivity. Higher values reveal resistance that must be addressed early.
You may be surprised, many people with normal finger stick readings post a HOMA IR well above 1, proving dysfunction lurks beneath the surface. Bringing the score down confirms that dietary oil swaps, targeted carbs, blood pressure control, and smoking cessation are truly restoring metabolic flexibility.
Combine those systemic actions with disciplined eye care. Set an annual reminder today for a dilated exam, and never ignore new floaters, flashes, or sudden blur. Even mild changes warrant immediate evaluation. Rapid intervention can stop small bleeds before they scar.
Here's your practical challenge. Over the next 7 days, remove every seed oil from your kitchen, schedule your comprehensive eye exam, and arrange a HOMA IR blood test. By this time next week, you will have eliminated a primary mitochondrial toxin and secured the data that lets you track improvement objectively. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.